Good afternoon, dental internet world. My name is Dr. Vishal Sharma, once again here alongside my friend and colleague, Dr. Mike Parchewski. Mike, it's good to see you up in Canada. We are in the midst of NHL playoffs, and we've got a few hockey teams that are still competing. One of them in the midst of a series with the Dallas Stars. They do say that everything is bigger in Texas, and I think that includes our guest and my dear friend who's got a big personality and will be a very, very entertaining guest. Mike, can you introduce our star from Dallas?
You bet. Thanks, Vish. Good to see you again. Welcome, Dr. Farhad Boltchi, a periodontist and an owner of DFW Implant Center in Dallas, and also a CDOCs resident faculty for implantology. And, I would say just one of the leaders in North America in implant dentistry. And one of my favorite speakers to watch he's always very up to date on the best digital workflows, which obviously for us is super important. Mm-hmm. And because he tests a lot of products when they're first out to market, I do find when I watch his education events that I'm getting myself also caught up with the latest and greatest. So welcome to the show.
Thank you. Thank you, guys. Appreciate the invitation and great to be with you and excited about this episode.
Right on, right on. Now, maybe to start us off, can you tell us a bit about your background, what got you into the periodontic specialty, and what took you down the road of the digital dentistry world?
Yeah, so it's a long journey, So I went to an American high school, but then switched to a German high school because I grew up in Germany. And so after that German dental school, which is typically 5.5 years instead of 4 here in North America. And then after that, I stayed on at the university as an assistant professor in the perio restorative department. In Europe at that time, there were no standalone perio departments, no periodontal specialty. So it was a perio restorative department, and stayed on there, got kind of my European perio certificate, but then met my wife, who's from Dallas in Germany. So decided to move to Texas. And of course, the US, they don't accept any other specialties from any other place in the world. So then I had to go back and do perio training, which was great. I loved doing it a second time. And it was more structured. It did that in Dallas at the Baylor College of Dentistry at that time. Now it's Texas A&M. Became a periodontist and then stayed on as a faculty for another 4 years, part-time private practice. Then went into private practice, my own private practice. And the journey to digital dentistry was very interesting because at that time there was no digital dentistry. But what happened is that I was in the market to buy CBCT scanner. This was in 2011, 2012. So then I bought a CBCT scanner from Patterson, researched it quite a bit. And 3 months after that purchase, then our Patterson rep, our local Patterson rep, showed me CEREC. And I'd already known CEREC in the past, but he showed me CEREC and what it can do with implants. And he was very much at the beginning, but it was so fascinating that at that point, I went a little bit above and beyond and invested a lot of money into I changed the CBCT scanner to another brand, the Dentsply Sirona brand, then bought the CEREC machine and a mill, which was unusual for a periodontist at that time to have all these capabilities in the house. 3D printing was not even on the horizon back then. And so my friends, my periodontal colleagues, called me crazy. They said, why do you need a mill? Because, we don't do crowns, we don't do inlays. But I saw the potential of everything integrating together, and I started doing provisionals. I just used the mill only for provisionals and started integrating the digital dentistry. This was, again, 2012. And then it kind of skyrocketed from there. And the things that we can do nowadays, I couldn't even dream of back then. So it's been great. It's been a great journey with digital implant dentistry.
That is quite the journey. So, Farhad, you grew up. Was it Bonn that you grew up in? Is that correct?
Yes, Bonn, Germany, which used to be the capital because my father was a diplomat for Iran. So Bonn had all the embassies. Then after East and West Germany reunified, then the capital moved to Berlin.
Got it. So, you live in Dallas now, a long-term Dallas resident. But if you had to pick a better football team, would it be the Bonner Soccer Club or the Dallas Cowboys? Are you at liberty to say, or will your neighbors get upset with you?
Yeah, there's no Bonn soccer club, but Bonn doesn't actually have a football team. But I think in most of the civilized world we call it football
That's right. Yeah. Well,
and not soccer.
some might say that much like the Bundesliga, you might have gotten relegated when you had to move to Dallas from Germany.
Yes,
But
exactly.
one
No,
thing,
but my favorite team is Bayern Munich, which they have been great. But I also love American football because I went to an American high school, so I love watching American football and I actually know the rules better than most people from Europe.
and your practice is in Arlington, is that right, Farhad?
Yeah, yeah,
Yeah. So
and
you're
it's
right.
right here by the Cowboy Stadium.
Yeah.
Oh, nice.
So, speaking of Dallas, you're also known to be a bit of a foodie. In fact, I can attest to that with some of your fantastic restaurant suggestions. So, does this love for precision for implant placement, does that also carry over to how you judge a great dish of food? Like, is it that same methodology and particular attention to detail and particularness?
No, this was something I fell into by chance, Vishal, because so what happened, I've got a great friend. He's a periodontist and he lives in New York City. And he's really I mean, if you're talking foodie, he's the one who introduced me to really good food. And I'm not the person who really likes, necessarily to go to Michelin starred restaurants because sometimes that food is artistic, but
Mm.
it's not really that tasty. So what happened is that our CDOCs faculty put me in charge of making restaurant reservations. So I did that once, and the first one was a flop. Everybody hated it, so I had to up my game, and that's when then I started then looking for restaurants. So now I've become the go-to person to make restaurant reservations. But to me, it just has to taste good,
Yeah.
right? That's all that matters. It doesn't have to be artistic. It just has to taste good.
Same with periodontal dressing, I guess, right? Doesn't have
Yep.
to work. It just has to taste good.
Yeah, we don't, yeah, exactly.
So Farhad, dovetailing off of the food side and onto the implant world, you teach a lot of implant dentistry programs at the CDOCs Spear Education Facility. For the dentists that are listening, what would be a typical course content that you would typically be delivering for them? For the dentist that's trying to get into implant dentistry, what would you be focusing on for the dentist getting started?
Yeah, so I mean, I think that honestly, first of all, I think it's great that more and more clinicians are getting involved with implants. The more people do implants, the more per capita penetration we have, which is still not very high in the US or in North America in general. So I think it's great. But if someone wants to get specifically into implant surgery, I would suggest we have an intro course for them to get started. That covers everything from the basics and focuses more on freehand implant placement because that's a skill set we still need to have. Digital technology for diagnostics, but really the surgery is taught initially freehand because you have to have that skill set. You cannot jump into using a calculator if you don't know how to solve a basic math equation, right? Because if once you don't have your calculator, then you don't know how to solve it. So the same thing with surgery, digital is a tool and it's great and I use it every day, but we have to be able to function without it if something happens. And then after that, I would say, we go into our guided surgery course, which is the one of the ones that I teach. And there we focus on how to make things really more predictable and more stress-free. And predictable just not just by the implant surviving, but by the implant being restorable and being long-term functional and aesthetic. So that's the goal. And then beyond that, then we have various, bone grafting and soft tissue grafting courses. So it's kind of a modular thing. You can kind of add to your skill set as you're going along. Start off with the basics. If you have never placed an implant, then go to guided surgery and then to basic bone grafting, advanced bone grafting, soft tissue grafting, and so forth.
Yeah.
I love the analogy with the math, but what I'll tell you, Farhad, is Mike places implants, and he hasn't done long division since Bill Clinton was the president. So I'm not sure if the math holds true. So, Farhad, I love the aspect that you have to teach the free-handed component because, of course, digital tools are just that. They're just an adjunct and a tool, not necessarily a crutch. But when you're teaching some of these courses, how are you integrating those digital tools and speak about sort of what scanners and software that you really emphasize in some of these CDOCs courses.
Yeah, so in our courses, we focus a lot on basically the CEREC workflow, the Dentsply Sirona softwares, and the workflow, just because of that's that's where CDOCs started as a CEREC education, platform. So that's our focus. But honestly, now when I started this integrated workflow was only available from Sirona at that time. Then Dentsply obviously merged with Sirona, but it was Sirona at that time, and that's the only one that was available. Now you've got many different platforms and many different digital tools that are available. In the CDOCs courses, we focus on the Dentsply Sirona softwares, on the CEREC software, in-lab software, CCAD implant software for implant planning, and then 3D printing with, for example, the Prime Print or any other 3D printer. But all of these principles, Vishal, are honestly applicable to different implant systems and different digital workflows. And that's the beauty of it. And the other beauty is that if somebody wants to get into digital, they don't have to necessarily invest $250,000 or $500,000 to begin with. It's all modular. You can start basic with a scanner, and anything that you don't have in the office, you can outsource. And that's the beauty of it to me. And we emphasize that as well, because not everybody has every piece of equipment.
Of course, yeah.
Yeah, there's a time now that I feel for the dentist getting into implant dentistry is such a good time now because there's so much available. And there's so many different ways to get your planning done, and there's so many different ways to get things 3D printed. So I do feel like it's a really good time to be a young implant dentist. And I do agree, like you both had touched on, that the skill set has to be there for understanding the feel of bone and the freehand concepts, so that when the guide doesn't fit or something's not quite going right, that you can recover, or if an implant is not in the right position, that you could remove it and reposition it. And I think that falls into dealing with harder cases such as immediates, that you know how to feel the bone density and know that you've got positive engagement with your implant. Now, dovetailing a little bit further, just because I'm a nerd when it comes to socket grafting and soft tissue management.
It's terrible pickup line, by the way. It's terrible pickup line. You can't use that.
Yeah, well, I'll pull that off the list. But Farhad, just for the listeners out there, a 4-wall defect that you're going to be grafting for I know immediates is often what people are moving towards, but for a simple socket preservation today, what would be sort of your go-to for everybody out there that you kind of lean towards as your day-to-day for preserving?
Yeah, so I think honestly, Mike, I think that socket grafting, I'm glad you brought that up. I think socket grafting is a great topic because unfortunately, in my estimation, it's been too dumbed down in the profession. And some of it is driven by product, from companies. Some of it is driven by some kind of misconceptions that are out there. But it's not always as easy as just kind of, putting some pixie dust in a hole and, it magically turning into bone. So, but I think that if you follow certain principles and understand the biology, it's one of the best procedures anybody can do in their practice because you can take very complex cases and convert them to simple cases. And it's something that even if you're not placing implants in your practice, you can basically convert these sites into beautiful implant sites if you follow basic principles. So to answer your question, I kind of like to distinguish between posterior and anterior because they're two different animals. And then posteriorly, let's start with posterior. You have to distinguish, do you have all four walls intact or are they not intact? And do you have buccal wall missing and so forth? So if all four walls are intact, one of my favorite materials is to use osteogen plugs in the posterior sockets. I was very skeptical of this material just because of the publications the company has put out there, but the material itself works really well. Now, the way I use it is a little bit different than what is being promoted. We cut it up, mix it with liquid PRF, and condense it really well. You'll have really beautiful results in a four-wall posterior defect. If there's a wall missing, then we use a membrane. In posteriors, my preference is to use non-resorbable membranes and then take them out at 4 weeks. And then in anteriors, though, I like to use mostly allografts because they maintain the volume better. And usually in anteriors, I almost always combine it with a long-term resorbable membrane because the wall, the buccal wall, specifically in anterior defects, is very thin. Even if you have a four-wall defect, that wall is going to resorb. So I like to counter that with these long-term resorbable membranes that add thickness and more protection. So it's kind of the way we teach the courses is to be able to understand the biology. And once you understand that, then you can take it and apply it to many different scenarios rather than just saying, you know what, I use this technique for everything.
Yeah, that's correct. That's a great summary. I do appreciate that.
Yeah, I was taking notes on that, Farhad, so that's great. I was actually going to come sit in on your course in a little while, but now that I got that, I think I'm just going to skip it and do
Yeah,
something more entertaining for the weekend.
Now, Farhad, when it comes to implant placements in general, or using digital technology, besides the understanding of the free-handed, being important and that skill set, what are some of the big misconceptions, or what would you say is the biggest misconception out there about placing implants in general that gets people into trouble when they're just getting started or learning?
So, and I say this in our courses as well, is that there are two, I think, huge paradigm shifts in implant dentistry. The first paradigm shift was that we went from a bone-driven implant placement to a restoratively driven implant placement. Okay, we as surgeons, when we started out, we placed everything bone-driven. Right, when Professor Brannemark introduced implants, it was all about the bone. And then throughout the years, we found out, hey, nobody wants to have a screw in their head. Everybody wants to have a tooth. So everything needs to be restoratively driven. And then we switched to restoratively driven. Now, the nice thing about the digital world is that we can basically design things digitally exactly the way we want the final to look like, the final house, let's say, and then build the foundation accordingly. But what I'm finding is that, unfortunately, a lot of people, even general dentists now getting into implants, if they don't do this, they go to the bone-driven implant placement scenario. Why? Because it's easier. It's always easier to place an implant where the bone is and not where the restoration is. There's an old saying that says every misplaced implant is beautifully also integrated. And that's true. So that's one misconception I think that people need to really pay attention to restoratively driven implant placement. And then the second paradigm shift that has happened, I would say within the last 3 years, is the importance of soft tissue. So now we're seeing that soft tissues are actually more important than even bone. So we need more and better soft tissues around our implants, and the focus is going a little bit away from the bone. We need bone to obviously anchor the implants, but we don't need as much of it as we used to think.
Yeah, no, I agree. I agree with that. That's great. that whole importance of biological width is super critical for sure.
So, Farhad, you've already given us some great tidbits on some of the courses that you offer and some great pearls of wisdom. Can you let us know what upcoming courses you have or educational content that you're developing either on your own or with CDOCs or DS? Give us a sneak peek into what's coming up.
Yeah, so one, I think for those of the listeners who are interested in regeneration, Dentsply Sirona has a great Regen Symposium coming up in Scottsdale, June 20th and 21st. Actually, and the lineup is amazing. I mean, the speakers, I'll be speaking too, but not because of me, but because a lot of great speakers are there from the US, a couple of people from Europe as well. And it's a great meeting. And the tuition is amazing. If you look at the tuition, I think the tuition is $750 and includes 2 nights at the hotel too. And it's just a wonderful 2 day or 1.5 day meeting with hands-on everything. So that's one I would definitely recommend people look into if it's not already sold out. The other one, the other things at CDOCs, we are starting to do a complications workshop and seminar too, because that's something, no matter how good you are, you will have complications. The only way not to have complications is to not treat patients. Everybody has complications. Even I have complications. Many great clinicians have complications. So we're putting a course together with our resident prosthodontist, Mark Ludlow, who is from the University of Utah. And he's going to be talking about restorative complications, and I'm going to be talking about surgical complications. I think that's a great course because, with that course, you can cover almost 99% of the complications and see how to prevent them and then how to treat them.
Yeah, that's
And
fantastic.
then, in addition to that, we're working on putting together some, life surgery courses as well. So that's upcoming too. So a lot of exciting projects like that on the horizon.
Yeah, that's really exciting. We had Mark on the podcast a couple weeks back, and he brought up that complication course as well. And I think it's really timely now because more and more dentists are getting into it, and I think the understanding of how to deal with the complications is becoming ever more important, and having good programs that teach it and how to prevent it, and also how to deal with it when it happens is great. So that's fantastic.
I think that's the main comfort component is you can delve into all of these new modalities in dentistry and you can treat them and learn all these skill sets. But when the inevitable complications come, how comfortable are you treating those? I think that's one of the big deterrents for dentists looking to do more. So yeah, we're really excited to see that course come to fruition.
Yeah, and the thing is, even if it's not a complication that is caused by, let's say, the clinician being inexperienced or by the patient, these implants that we're doing now, they are in the patient's mouth longer and longer. And so it's inevitable for a certain percentage of these implants to have periimplantitis. And alone the treatment of periimplantitis, it's a whole field in and by itself. So I think that it's exciting for us to put that course together and to convey all this kind of this pearls that we have learned in practice to the attendees.
Yeah, I appreciate that. That's great. Now, just because I've always want to pick your brain on new tech, is there anything coming down the pipeline, maybe with AI planning or something along the 3D printing? Is there anything coming out that we should be aware of?
Yeah, I mean, it's a lot of new exciting stuff. A good friend of mine, who I used to teach some of the CDOCs courses with, he's a prosthodontist, Amir Zandi, and he has done a lot of research on 3D printing zirconia. So I think that is coming down the pipeline, 3D printing zirconia. There are some, as far as regeneration goes, we're looking at now 3D printing zirconia scaffolds to screw in for big, huge vertical augmentations. That's already being done in Brazil, and I'm just looking forward to doing that here as well. And then on the AI side and on the implant placement side, I just got back from a meeting in Rome, Italy, actually, where I went and attended a course myself and he was on navigation guided surgery. But the next step to that is going to be almost completely robotic surgery. And the potential for that is tremendous. The accuracy is tremendous. The potential is really tremendous, especially for these more complex cases like full arch cases involving, quad zygoma implants, pterygoid implants. So I'm excited, and I honestly, somebody asked me this at one of our courses. He said, "How do you prevent burnout?" I said, "How can you get burnout when every day you go to work, you're playing with toys,
Yeah.
right?" So
So,
you can never get burned out if you keep playing.
Farhad, I'm just counting down the days until a robot takes my job. I'm sure my patients will be excited because that robot will have a much better sense of humor. But for you, when a robot comes to take your job, I would do what a professional athlete does: open your own restaurant in Dallas. I'm not Farhad's Foodieville. We can call it. We can go from there. You'll have 2 customers with Mike and I for sure. So Farhad, as we're wrapping up, like, any last advice that you would have for dentists who are like looking to elevate their implant game through digital tools in the right now and beyond? Like, obviously taking some of the phenomenal courses that are available at CDOCs would be one great step. But what else would you suggest for our dentists who are on that journey and looking to elevate their game?
Yeah, I mean, I think you cannot really practice dentistry nowadays without being involved in digital technology, no matter what you do. So you have to get into digital technology when it comes to implants, definitely. So I would say, for dentists, it's an investment worth making. It will pay off. For me, when I made the investment 13 years ago, I wasn't even looking at getting an ROI on it in terms of making money on the equipment. I just wanted it for quality control. And as long as I would break even on it, I was fine. So I think, dentists should definitely get into digital technology. And the other thing is, you know, really invest in your education. Even to this day, Vishal knows this. I think last year I went to, in addition to teaching 40 courses here in the US, I went to 10 and attended 10 courses in Europe. So, you always have to keep education going because there's always new stuff. And the third thing is that, we all need to know our limitations, right? So what Vishal said earlier, I have something I live by. If it's a procedure that I think I cannot handle the complications, then I will not do that procedure myself in my office. I will refer it out. And so I think those 3 things, if you do that, then you'll be very, very happy, practicing dentistry because it's truly exciting times.
Well, that's great. And Farhad, hopefully we'll see you up for some education at a ski resort in Canada next winter.
Oh, I would love that.
Yeah,
I like
I would
that.
love that.
We'll
I'm counting on you, Vishal. Putting that together.
I'll get working
We'll get
on
it.
it. I'll get working on it. Farhad, this has been a lot of fun. We want to really thank you for taking time at the end of a busy clinical day for chatting with us. It's been really, really insightful. And our listeners certainly, and Mike and I are excited to see that upcoming course that you and Dr. Ludlow will be doing. So thank you for your time.
Anytime. And then if you guys come to Dallas, text me and we'll go out to eat.
Yeah, you picked the spot.
Would love that.
Right on.
Thank you so much, guys.
Thank you so
Appreciate
much. Thanks again to you, and thanks Vish, and to all of our listeners. Thanks for tuning in. Please like and subscribe on all the socials at Digital Workflow Dentistry and on all the podcast choices out there. We are there. Podcast 46. Thanks, everybody.